So, before we are going to cholinergic drugs, or we call these parasympathetic mimicking drugs, we have to know how these drugs are formed in the nerve terminals. So, the drugs we use to mimic the function, there is a classification and there is some specific drugs, and also there are specific mechanism that how they work, and there are indications and there are contraindications and there are side effects as well. So before that, in the parasympathetic system, we have to know how the parasympathetic nerve terminal works. So first, in the nerve terminal, before the impulse come, the choline is reuptake, and the choline is combined with acetyl CoA, and choline and acetyl CoA form acetylcholine. And those acetylcholine, as you can see, it is first on the vesicle. So before the sodium comes in, it means the when you before the activating the parasympathetic system, before the sodium comes, so acetylcholine, these neurotransmitters are in nerve terminal vesicles. So when sodium comes, nerve impulse come, so calcium goes in and it bind with these acetylcholine contain vesicles, and it release into these synapses. So when acetylcholines are in the synapses, the acetylcholine will bind with the acetylcholine receptors, and after the mimicking the function which we need to do in the parasympathetic nervous system, the excess acetylcholine will be degraded by acetylcholinesterase enzyme. So it will degrade acetylcholine into choline and acetate. So these degraded choline will again reuptake into this proximal nerve terminal by this sodium choline channel. So this is basically what happens in parasympathetic nerve terminal. So there is a choline, there is a acetyl CoA, they combine together and they form acetylcholine, and acetylcholine is now in the receptors or inside in the vesicles. When nerve conduction impulse come, calcium is bind with these vesicles and release into this synapse. Synapse is nothing but the between proximal nerve terminal and distal nerve terminal. It could be distally a muscle or another uh, neurons distal synapse. So this is what happens basically. So we have to know, when we are talking about parasympathetic drugs, we have to know what are the receptors. So in the cholinergic receptors, there are five main cholinergic receptors. But for us, mainly important ones are first three. This M1, M2, and M3. So there are M4 and M5 as well. So it is not mostly clinically important. So M1 is in the stomach, M2 is in the heart, M3 is in the exocrine glands, sweat glands, eyes, salivary glands, and bladder. So mainly in here there's exocrine glands and salivary glands and bladder. So when you are talking about parasympathetic system or parasympathetic drugs, you have to know what is the action of parasympathetic system. So basically what we are doing from these drugs, so the mimicking the function. So when you know what is parasympathetic system does, that is what is going to do by the drugs. So if you know what is going to do in the parasympathetic nervous system, then you know what these drugs are going to do. So, as an example, M2, there's a heart. So, in the parasympathetic state, your heart rate will be reduced. So, this is basically what these drugs are going to do. Nothing but fancy. Okay. So, nothing fancy. In the M3 receptors, they are located in the bladder. No? So, in the parasympathetic system, in the when you are in the relaxed state, so your bladder should be emptied. In the sympathetic system, it is other way. So this is what happens. So bladder will be it's it, I- bladder will be is going to be released, right? Sphincter will be open and the retented urine will be released. Okay, so this is what is going to happen. So always have to remember, when we are talking about parasympathetic drugs, we are talking about parasympathetic nervous system. So some mechanism we have to know. Doesn't have to know every mechanism, but the main mechanism we have to know is what does M1 do. M1 receptors does and bind with the parasympathomimetic drugs, and what how does it happens in the M2 mainly. So in the M1 in the stomach, no. So what basically happen is it increase calcium 2 plus intracellularly. It will cause contraction, it will cause secretion, it will cause neurotransmission releases in the stomach. Okay, so in the M2 it will increase potassium plus intracellularly. So basically what does it do? I mean, it decrease the heart rate, bradycardia. So that is what happened. So so this is the basic mechanism what is happening. So when someone is asking what how does this mechanism occurs in the M1, it is basically increase calcium 2 plus intracellularly, and it will increase secretion, and it will increase GIT contraction, and peristalsis will be increases. What does parasympathetic system do? That's what basically happen. So main classification of the parasympathetic drugs is this. It is direct acting cholinergic drugs and indirect acting cholinergic drugs. So direct acting means it will bind with these receptors and straightly increase the function of parasympathetic system. But in indirect ones, there are two types: the reversible ones and irreversible ones. So in the indirect one, they basically act on this acetylcholinesterase enzyme. Either they could inhibit this acetylcholinesterase enzyme reversibly or irreversibly. So when you know this acetylcholinesterase will degrade acetylcholine to choline and acetate, if it is inhibited, acetylcholine concentration in the nerve terminal will be increased because it can't be degraded anymore, because we are inhibiting using drugs. So that's what is indirect acting cholinergic drugs does. It could be inhibited reversibly or irreversibly. Reversible ones are more clinically relevant. Irreversible ones are not more clinically relevant but can cause poisoning. So when you are talking about organophosphate compound poisoning or agricultural poisoning or toxic drugs very respected with the side effects when irreversible interacting cholinergic drugs does, so they are basically talking about these kind of drugs. So we have to know some of these drugs and what are indicated from them. So first one is direct acting cholinergic drugs. Mnemonic is ABCMP. Okay, A means for acetylcholine, B means for bethanacol, C means for carbachol, M means for methanacol, P for pilocarpine. So those are the five main drugs: A, B, C, M, P. It's a mnemonic. So indications are what? This is what we could be achieved from parasympathetic nervous system activation. We could be used for urinary retention. Okay, to decrease intraocular pressure, to decrease heart rate, for meiosis, priority prior to eye surgeries. Before eye surgeries, if we need meiosis to happen, meiosis means what? Pupillary contraction in the sympathetic nerve system. When it is activated, it will be cause mydriasis. No, it will dilate pupil. In parasympathetic system, it will constrict the pupil. So when we are going to do some eye surgeries, before that we need that action some relevant to the eye surgery. So we use these drugs. Okay, so those are the main five drugs and main indications. And what are indirect acting cholinomimetics or anticholinesterases? Anticholinesterases, we call these drugs as anticholinesterases. Mechanism of action: bind to acetylcholinesterase and inhibit the action reversibly or irreversibly. So, according to that, respectively, there's a reversible indirect acting cholinomimetics and irreversible indirect acting cholinomimetics. First one is reversible cholinesterases. These are more clinically relevant. Mechanism of action: bind with acetylcholinesterase and inhibit the enzyme reversibly. So, after some time, even though acetylcholinesterase will be inhibited, after some time it will be again reactivated. Okay. So, mnemonic is drug pain. D means donepezil, R means rivastigmine, A means ambinonium, G means galantamine. Pen, P, there are two drugs, predostigmine and pisostigmine. E means edroponium, N means neostigmine. In here, I have in the brackets I put edroponium is used for tensidone test to diagnose the myasthenia gravis. Okay, so these are the main indication: donepezil, rivastigmine, and galantamine. These three drugs is used for Alzheimer. Okay, donepezil, rivastigmine, and galantamine is used for Alzheimer. Pisostigmine we use for atropine poisoning. So after some time we are talking about the cholinomimetic poisoning as well for the irreversible ones. So in that we use atropine and pyridoxamine. But if atropine is poisoning, we use again the contrary the pisostigmine. So uh, we'll talk about more, but for the edroponium we use for the diagnosis of myasthenia gravis. This is short acting reversible acting indirect cholinomimetic drug. So when myasthenia gravis patient comes, he is more fatigued, so he is very slow, and the auto antibodies are closing those acetylcholine receptors, and patient can't move his limbs and everything very well. So we give edroponium, and edroponium will increase those symptoms for a short time. So if it is increasing, that is myasthenia gravis. So that's how we differentiate this myasthenia gravis from edroponium test. The tensidone test we also use, this is the name, but now clinically we don't use this tensidone test due to risk of bradycardia and could cause cardiac arrest. So there are other tests that we could use to diagnose myasthenia gravis nowadays. But now questions could come: what is the main use of edroponium? Edroponium is nothing but is to the tensilon test. Tensilon test means diagnosis for myasthenia gravis.